Up to 60% of people will develop thyroid nodules by the age of 60. Most don't cause any symptoms, but there is a newer, less invasive way to treat them if they do. And Olivia Bosser talked with a local woman who underwent a rare operation and credits it for helping to save her singing voice.
Oh, I always like to sing.
Cynthia Galashin is a member of the choir at the Belmont United Methodist Church in Johnstown. But when 2 nodules were found on Cynthia's thyroid, there was concern her performing days could end.
They found I had 2 that were large, and the one was pressing against my trachea, which made it hard to swallow. The other one was pressing against my vocal cords. Now, it didn't really affect my voice that I noticed, but the doctor said that he felt that it could eventually damage my vocal cords, and I could, perhaps, lose, or my voice would be altered.
Cynthia tells me that fear was only doubled when there was a risk her nodules were cancerous.
A lot of prayer going through this. I mean, even just when I first found out about the nodules and worrying about cancer, and I have to have a biopsy, that was so scary, but definitely had my church family praying for me.
Thankfully, Cynthia's nodules were benign, meaning she had options: traditional surgery that would leave a scar across her throat, or be one of the first to try a newer, rare treatment.
Radiofrequency ablation offers a non-surgical approach, a less invasive approach, option of treatment for these nodules that avoids general anesthesia, avoids a surgical scar, and also, importantly, preserves normal thyroid tissue.
Dr. Alina Mararu is a clinical assistant professor of medicine at UPMC. She performed radiofrequency ablation, or RFA, on Cynthia's nodules, and the procedure was successful.
So we treated initially one nodule that was more superficial and more visible, and she had a pretty significant shrinkage of that by about 80%, even by 3 to 6 months after her initial treatment, and she was very pleased with the result of that. And so to more adequately address her symptoms, we also then treated her second nodule several months later, and she had pretty significant shrinkage of that as well.
The use of RFA for the treatment of benign thyroid nodules was FDA approved in 2018, and UPMC began offering the procedure in Pittsburgh in spring of 2024.
We're thrilled, to be able to offer this this option to patients. Not just because it's less invasive and faster recovery time and less disruptive to their life, but also because of lower risks of certain complications.
While RFA does not completely remove the nodule, it leaves behind only a small, non-bothersome amount of tissue, meaning Cynthia is back to singing.
After I had the treatment, I could feel that my voice was stronger and clearer.
In Johnstown, Olivia Bosser, WTAJ News.